The Red Cross Society in Kenya has been at the forefront of efforts to improve health standards in the community. In collaboration with the Tharaka Nithi County Health Department and others, this organization invested in the use of volunteer health workers or CHVs in the grassroots. For a while, these community health volunteers have been providing important training about the best way of life in the community.
Lakini maero dia umantura makuja maturutanire wega muno maya batuoneria korera bweri kagigwa korera bura gumba gwita bonge utariricia korera bagomba kuona mwana uyu ena korera ukagita bonge aturipotire immediately.
The new government that has just come in partnered with the Kenya Red Cross and revitalized the community health strategy because it was not fully embraced within the county. And so as a result of that, the communities were not participating in management of their own health, in prevention and control of the epidemics. It was very minimal.
These community health volunteers have recently been accompanied by their sponsors on a journey to highlight some of the successes witnessed from their work in the various villages and schools.
Kenya Red Cross has been working with the Tharaka County government since 2018. To implement the Community Epidemic and Pandemic Preparedness Program. The goal of the program is to empower communities to be able to prepare for, to detect, to respond to any epidemic outbreaks in the community.
We are here today because of a project that we are implementing with Kenya Red Cross by the name Community Epidemic and Pandemic Preparedness Program that is implemented globally in 7 countries with funding from USAID.
The menace of death caused by diseases such as anthrax, which results from consuming untested meat from dead livestock, and other issues like dog bites and cholera, which is caused by poor sanitation, have been rampant in these areas in the previous years.
Lakini kuma murandi uyo tokwambiria wa CP3 program uthie kesi ya korera Tharaka Nithi County kana community yetu twagwa twina kesi ya korera itwagwira tukenete muno nontu bwa murandi uyu nontu nitutethetie muno kumenya kinya mirimo tutaize ya anthrax kiongo tutaize kinya symptoms ciacio.
Due to trainings of this organization, the problems have significantly reduced as a result of their motivation to the communities to avoid practices that lead to these dangers.
The Community Preparedness, Community Epidemic and Pandemic Preparedness Program, it's a pilot project that prepares communities to be able to understand common diseases that can cause an epidemic or a pandemic within their localities. And through Kenya Red Cross, we build capacity of these communities to be able to detect, report, and then influence early action to these outbreaks before they become an epidemic or a pandemic.
Na kinyama andini matatenda hospitali. Ntodi yatu tokazi tokaboneria na kemone kabisa tokaboneria. Mchanjo ino ni mbega takagita kaingi muno mchanjo ino cha kiduku, mchanjo cha typhoid, mchanjo ta ino inge tokabone ni mbega kinyoro metukuro ote muchanje at least ni mbega.
Tu abarutanire batikare nyama itare ndime kana banywa eberia ritere samokie. Tu abarutanie mantu mako gochamukagia eria na gotwekaga batikare nyama itendime.
In these communities, many people like to keep pets like dogs and cats in their homes. These animals sometimes can bite and cause various ailments. These community health volunteers have taken the responsibility to train the locals on the importance of vaccinating their pets.
Bai takinya batuthomithia megie mirimo nyingi mbali kinya wa muntu waro mongi nyire kiwa kiwongo bawo menjetire bawo bakuruza uchoke bwa kinya ntugo ya guchanja bakuro batutumagire bakati round mero round abetwira tukitwa chanjire kuro kinya tutungo kinya rwane ndeka mantu mama umagira kainge muno aya tu bakatu insist tukaruza.
We also work very closely with the county government, especially the Ministry of Health and also the Ministry of Agriculture and Livestock, to ensure that we have preparedness frameworks within the county that inform swift response whenever an outbreak has occurred. Additionally, we also work with the key stakeholders, including private sector, especially people who have private clinics, people who are running agrovets within the county, to ensure that they are prepared, and as they attend to patients for the clinics or animals that are brought to the veterinary clinics, then they can also report those diseases to the local authorities.
The locals have embraced this training, and it has brought a significant impact on the community so far.
Anto bainge ibajira kutogwata bwega na gutwenda, especially kinyanto bakabonokia watu ekitu atani nyanto bakabonokia muhimu nyabwa mathomo muhimu bwa bioro na bonde bagwata babainge bamo bakabonokia kinibadi bairiana kiguru kumanya na ithomo byetu na babainge batari na bioro ntorani benja bioro kumania na mathomo metu bara batari na ndigosi bekira na bara batachanjagirwana bathi guchanjithia bara beyagirwana kinyameci batwire kuewa sibitari na ino tanto baingi bona bereto kinya ana meci na ino batija sibitari.
Wanatufunza sio tukakula mizoga ya ng'ombe yote ama mbuzi kisa kupeleka hospitali tukule ng'ombe ambayo imepimwa. Ile nyingine ni mambo ya kuwa mgonjwa. Pia natuambianga tuende hospitali na tena tuondokea nyumbani kipati mzuri tukia hapa na karatasi wanapea mtu. Yaani nakimbia mtu sana kuingia pale kina kigezo na ingia direct. Kama na kipi ndio tunajua anafanya.
The CHVs have visited various schools to educate students on the quest to ensure that the message is spread widely. The students have been educated on the signs of these diseases and how to protect themselves and others. The students also, with the help of teachers, have formed clubs and organizations in their schools that provide training to their peers in the community.
The reason why we are targeting school-going children, number one, school-going children, they are actually agents of change. They are good conveyors of messages, that is health messages. On weekends, they are basically at home, whereby they stay with their parents. You know, parents have a lot of trust with their children, and we basically want to use them in order to increase our coverage in terms of spread of health messages.
The Red Cross team made a trip to Nithi Primary School in Tharaka, Nithi to check on the progress made so far. They also visited Gashiongo Clinic accompanied by a group of veterinary officers from Tharaka, Nithi County, where they were warmly welcomed.
Karibu, karibu, karibu wageni. Mkasema mjakaribishwa. Pole sana kwa safari iliyokuwa ndefu. Pumzika hapa kwetu. Karibu, karibu, karibu wageni. Mkasema mjakaribishwa. Pole sana kwa safari iliyokuwa ndefu. Pumzika hapa kwetu.
The Red Cross team also visited Mukodhima constituency, where they met the CHVs in the area. They proceeded to visit the home of one of the beneficiaries of the training from the CHVs. There was a good indication that there has been a positive impact of the training program. The people had learned a lot and adopted the best practices on how to protect themselves from the various diseases.
Na nyingine tunafanyanga tukiona kuna tuseme kama mambo iko na jina, ni lazima tupigie wengine mtu ambie kuna mambo imekitelia njia ndio waweze kusunga watoto wasio kama hiyo hii kawaida. Na sisi pia tunaiwinda kabisa sababu kienee na tuletea shida kubwa.
Tunaiwinda ile ya kuua ama
kuua hakuna kusamea hiyo sababu huwezi karibia. Sasa nyingine tunakuanga ni kama wanatumia tukiona kama kuna ng'ombe imegonjeka mahali Ili tumwambie sababu inaweza kuwa kimakosa na tunapewa watu. Ndio awe na awareness hiyo kitu.
The journey led them to Ntoroni High School located in Mukodhima, Tharaka constituency, where students talked about the benefits they got from this training.
CP3 stands for? C stands for? Community epidemic.
People in these villages had learned the importance of washing their hands and having clean toilets in their homes.
Mtu amenyire mantu maingi muno makumania na CP3 na itwakenere muno nuntu bantu bau bathuganirie kuruta murandi uyu na Tharaka na twabaromba Ngai na batethie benderie na moyo ugu guturutana maingi muno konsani bura tugaturania na antu nikenda tuthiria mathina ma mariku na tutwika twinero thimbega.
This showed a great improvement in their sanitation from 5 years before, when cholera was rampant in the area.
Asa mwanka kinya wandukirie mukuru wakwa na kagita gwini to kurinda to aringikire muno kinya ntura na ndene musiujo wakwa na intemende kuma agu thirikari nene yazokiria tua no dunia tusetere masibitari mbali mautetheria na macho kutunengea CP3 magututetheria tuna migambo na kutiurukaga na utuoneria.
As they concluded their visit, the Red Cross team and the assessors went to Igamba Ng'ombe ward located in Chuka, Igamba Ng'ombe constituency, where they held a meeting with the volunteering health workers. Here, they discussed the progress made by the community health volunteers. Primary school students were also present in the meeting, and they were able to learn a lot of things.
Hapa unaambiwa huyu mtoto nenda jakubwa manja kundao hapa kwa kichaka. Naambiwa this is wrong. Naambiwa the correct is to go the toilet or the bathroom. Hapa ni mtoto na vaccines shindano ili azuie ugonjwa kama polio, coronavirus.
At the end of their visit, the Red Cross team were contented because they were assured that the residents had already received quality training from the CHVs. They found out that there was a significant reduction in cases of cholera, anthrax, and other related diseases.
Antu bange community ni bakenete muno nontu bwatigo CSDC bondo mumbwetu nontu in case of any alert itoiga gwatore function tokadi to menye murimo mubi kana to bara timbere baye batu to bere.
We have a total of 20 community units, whereby each community unit operates with 10 CHVs who are supposed to cater how to move around the villages. They have specific villages that they supervise, and there are specific indicators that they move house on to house on.
We also engage the local media. We have trained local media personnel, including from Tharaka County, on lifeline reporting, so that they can be able to work with the Kenya Red Cross team and the technical teams from the line ministries to be able to design messages for preparedness and also for messaging during an active outbreak.
They concluded by urging the residents to continue to uphold cleanliness and to make sure they have vaccinated their livestock to avoid diseases that may affect them.